Well, contact tracing, if done properly and quickly, can minimize the spread of any disease, especially one that is as contagious as COVID-19. But several local health officials are sounding alarms that the quality of contact tracing in Indiana is falling short, and that's putting Hoosiers at risk. My colleague Brock Turner is here with more. Hi, Brock.
Hey, Joe.
You know, contact tracing has been around for decades, but certainly it's something we're hearing a lot more about with COVID-19. So why does contact tracing seem to be so much more important with this virus?
Yeah, it really comes down to scale. So if there's a hepatitis outbreak tied to a restaurant, you're dealing with a finite number of people. Plus, it's pretty easy to develop a list of who ate there. Health officials tell me contact tracing for COVID is much more difficult because you're tracking a large number of individuals and the virus spreads by airborne droplets. So health officials in many counties are quickly becoming overwhelmed and were forced to temporarily suspend routine operations like vaccinations, for example. So to deal with the influx of COVID-19 cases in their communities.
You know, we've gotten a lot of questions into our newsroom about the contact tracing process. Who's managing it, and how do you become a contact tracer?
Yeah, Joe, so the state added resources to manage contact tracing, but hasn't taken it over completely from local health departments. Now, some counties are relying solely on the state support, and a lot of others are just augmenting what they're getting from the state. Indiana paid $43 million to a Virginia healthcare outsourcing company for about 500 contact tracers to help out these local health departments. State Health Commissioner Dr. Christina Box outlined the importance of contact tracing ahead of the deal's announcement. Here she is talking about it in April.
The process of calling a positive patient and identifying all of their contacts, as you can imagine, is extremely time-consuming, and many times people do not answer their phone if they don't recognize the number calling them. I know I wouldn't.
In theory, this was supposed to take the burden off of local health departments and allow them to start providing normal services. However, that's not happened everywhere.
So, Brock, what problems are occurring?
Yeah, Joe, there are really two major problems that local health officials are pointing out. The first has to do with the quality of contact tracing. Local departments say many of the cases are marked as complete, but then when they open up those files, there's a lot of missing information. Kayla Hostetler runs the Tippecanoe County Health Department, and she's here talking about the importance of contact tracing.
So if it's not done well, we can't stop the spread of COVID-19. You can wear a mask and you can have mitigation strategies all you want, but if you're not stopping and quarantining people when they have a known exposure, you're not going to stop the spread of COVID-19. And so it's so poorly done that my staff member would not have a job if this was their quality of work.
On the surface, these filings look complete, but details are lacking, and that can have serious impacts on the health of Hoosiers.
Yeah, that makes sense. What's the other major issues that you're hearing about?
Yeah, the other big issue here is with the transfer of data that are attached to each person who is tested. Initially, local health departments were told that the state's database that tracks new positive cases would merge with local health departments and contact tracers. That hasn't happened yet, and local health officials tell me they're losing patience because even a small delay in tracing contacts could lead to more infections. ISDH says they are aware of this issue and are working to resolve them. But that being said, it's been nearly 2 months and it doesn't seem like much progress has been made.
Okay, one more question, then we got to go. We're still continuing to see hundreds of new infections every day. Any thoughts on how local and state leaders might work to fix some of these problems with the system?
Yeah, some counties say they're considering doing contact tracing all over their own and taking it back over from the state if ISDH and the tracers can't work this out. There is some funding available that could help local departments defray some of those costs, but perhaps the most telling thing that nearly every health official I spoke with unprompted said that they just wish the state would have given county health departments more resources to handle tracing locally.
All right, Brock, thank you very much.
Thanks, Joe.